My number one pet hate is when clients get given the exercise of chewing on a pencil. It's a very outdated exercise. It unfortunately has not been taken out of the GP. They have an old manual that I think they've forgotten to take that out. You're just over exercising a muscle that's already over exercised from your triggers. You need to assess your triggers, not the muscles, because jaw pain is about the inflammation and the disc that is swollen or aggravated. The muscles are the end result of all your triggers, like poor sleep, insomnia, body inflammation from poor diet or autoimmune conditions, or eating too much sugar, so poor diet, or having too much coffee or smoking or too much alcohol. You need to address your triggers in your life rather than the muscles. So no chewing on a pencil. Obviously the lead in the pencil is not good for you at all, but you're not using the right muscle and you're not assessing which muscle is the one that's overactive. The next exercise I don't like clients to do is to overstretch their jaw. So don't stretch your mouth open as an exercise. Again, it's not the muscles as the primary reason for your pain. Your muscles might be bigger and more developed because of the triggers in your life. So please assess your triggers, your stress, your poor diet, your poor work-life balance, the way you were brought up, all these little things that contribute to grinding and worrying. The other exercises I don't like are the force open maneuvers that some clients do when they get stuck. Please do not force your mouth open. We do have an exercise that can force the jaw, but it comes at the end of treatment once the inflammation is gone and the pain is down, and there's a very specific way of doing it so you don't damage the joint. If you do it this way, you are going to damage the joint and the cartilage, so please do not do that. The other exercise or fidget or maneuver that I hate, which will make your jaw sore and it really yanks on the disc and inflames it even more, and that is akin to looking like a bulldog. So people often jut their jaw forwards because the disc is swollen and it's sore and they're trying to get away from it. That will just make it more sore.